Thanks very much, everybody. Welcome back to Dungannon. It's a little brighter today. Today we've had a sobering assessment of the current phase of the pandemic from our Health Minister, Robin Swan, based on the latest medical and scientific evidence. And we all know that what we're battling against and that it has been moving swiftly across the community during this winter wave. Our hard work together and individually over this last 4 weeks has pushed the R rate for cases down to well below 1, now between 0.65 and 0.85. So by our collective efforts, we have halved the rate of cases in a fortnight, and day by day we are reducing that further, and we've done so right across Northern Ireland. So that shows that our efforts are having a real effect. So by close of play yesterday, 166,538 vaccines had been delivered, including 144,212 first doses. For the Phase 1 high priority cohort to be concluded by the end of this month, 83% have been vaccinated so far. And it's anticipated that all over 80-year-olds will have been offered a vaccine by the end of this week, and we will be commencing the over 75s group next week. Each week, the Executive considers data on mobility, and we can see that there has been a significant reduction in the number of people travelling, and this reflects a personal decision by so many of you to do as we asked you to do, and that was to stay at home. And for that, we really do thank you, because you are saving lives. Again, I want to commend all those who are helping make this possible, to the employers and managers who are supporting staff to work at home, to all of the supermarkets, food stores and pharmacies who are running efficient delivery services, and of course to our teachers and lecturers who are supporting the education of our young people off school and off campus. We have made progress, but our war and battle against COVID is not yet won, and our hospital case numbers remain at extremely high levels. So we're asking for that support to keep going. To not press forward would risk all of the hard-won gains. So we need to keep pressing forward to provide our National Health Service with the full relief and the respite it needs from COVID. This week, the NHS is facing the peak of COVID demand, and the system is truly struggling to cope, and that's been recognised by the request for military assistance. We've seen that in the pressures on our ICU beds, the pressure on our general hospital beds, and of course the human burden on our staff. We know from back in the autumn that these numbers will only decrease very gradually, and that this will be the situation for the coming weeks. So we're asking our NHS to keep on going, and as a broader community, in order to support them to do that, so must we. The Executive today has reviewed the current restrictions and agreed that they remain an appropriate and necessary response to the serious and imminent threat posed by COVID-19. And following a detailed outline from Health highlighting the continuing pressures on our hospitals and ICU departments and the emergence of the highly transmissible variants, the Executive has agreed that the current restrictions will be extended for a further 4 weeks until the 5th of March 2021. The restrictions will be reviewed on or before the 18th of February. Now, I appreciate that this will be disappointing to many people listening to us this evening. I think particularly of those who are feeling the pain of separation from loved family members and friends, for workers and employers who are worried about their livelihoods, and indeed parents who are juggling the education of their children with work and other responsibilities. Separate arrangements have been in place for our schools outside of these regulations, and the Executive will have a comprehensive discussion next week around schools returning and, of course, the broader education issues. This is undoubtedly the most difficult of times, and we know the sacrifice that you're all making to save lives. And as an Executive, we are committed to taking every possible step to move us forward out of this pandemic. We have invested in the development of a robust and effective vaccination programme and in a highly efficient contact tracing service which has a 24-hour turnaround in 93% of cases. And both of those services, the vaccination and the contact tracing, are the envy of other jurisdictions. Our UK four-nation partnership has delivered medical support for our hospitals from our armed forces, a national vaccination programme that is world-leading, unprecedented funding which has proved invaluable across all facets of our society, and the establishment of genomic testing, which will be crucial to the fight back in relation to the new variants. At present, we estimate that the UK is undertaking 40% of all genomic global sequencing. So we're pushing ahead with our work on a pathway to recovery. The COVID-19 task force are going to bring recommendations on the approach to a relaxation of restrictions to coincide with our review in February. But in the meantime, we're asking people to keep going, to follow the public health advice, stay at home as much as possible, and remember, if we all work together and we do it, we will get through it. Michelle.